My name's Amanda. I'm one of the PAs here at Pennsylvania Pain and Spine. And one of the myth busters I'm going to go over today is whether or not opioids always lead to addiction. So this is a conversation I have with a lot of my patients every single day. There's a huge stigma attached with opioids that we always go over. A lot of patients are skeptical whether or not to start on medication, and what I like to explain to them, it's always a matter of your pain and your function. So if your pain is really limiting your overall function, your quality of life, the things that you need to do and the things that you want to do, then we consider options like opioids. So typically before starting any opioids, we go over a whole slew of treatment plan. So we go over other interventions, including injections, physical therapy, different procedures that we offer here at Pennsylvania Pain and Spine. If those procedures fail or you're still having limitations in your overall quality of life and your function, then we add in a prescription medication and monitor things closely with that. So one of the ways we ensure that patients are safely taking the medication, we have strict protocols that we like to comply with, and that's both for the patient's safety as well as the practice safety. What we typically do is see the patient every 30 days. We go over the medication, the pain, and other interventions that can be completed. We also do random urine drug screens. That's just to ensure the safety of the patient, that you're taking the medication appropriately. We also always follow the guidelines regarding a safe opioid prescribing policy. That's typically updated once or twice, maybe 3 times a year as the protocols change. If the patient has questions or concerns, we always go over them at the visit. This ensures that there is no issues leading to addiction or things like opioid tolerance. We also go over if the medication stops working, then we consider other options or we consider other medications. Therefore, there's always an open and honest relationship between the provider and the patient. If a patient is truly concerned about the addictive properties of opioids, there are plenty of other options that we can consider regarding medications. There is non-steroidal anti-inflammatories or NSAIDs that helps with pain and inflammation that does not have any chance of addiction. There's also medications including neuropathics, which really help with nerve-related pain. So we can always consider other medications or safer options if that is a true concern for the future or family history, things like that. So that's why it's important to follow up on a regular basis so we can discuss all treatment options and come up with a good and targeted treatment plan that's right for you. I hope this helps clear up this myth that all opioids or pain medications lead to addiction. If there's any questions or concerns, it's important to follow up with us so that we can go over these concerns and come up with a good plan and establish these treatment goals.